Alright, this is going to be a review for anti-infectives. So, a few things right off the bat you want to be aware of. So, a good way to study anti-infectives is to think of what are the general complications and considerations for all anti-infectives, especially antimicrobials or antibiotics, and then go from there and break down each separate class. Okay, I know the generalized complications. What are some things you want to be aware of for everything else? So, first up, you're going to be aware of you want to do your culture and then sensitivity before you give any anti-infectives. You want to culture whatever is infective and do sensitivity testing so you know exactly what is the best medication to treat the infection you have. Doing this will help decrease the risk of um, antibiotic resistance or just resistant infections. And so we're going to start with the bacterial cidal first, or I'm sorry, broad spectrum first. Doesn't matter if it's cidal or static. Broad spectrum anti-infective first, and then we'll do a narrow spectrum. The broad spectrum is going to work on a large variety of infections. Then the narrow spectrum anti-infective will work on a very specific amount of infections to help decrease resistance, as I said. When it comes to antibiotics, there's bacteriostatic and bactericidal. Bactericidal is going to actually lead to the death of the bacterial infection, and static just basically puts it in stasis and then decreases the growth, inhibits the growth and function of the bacteria itself. So when we are doing a broad spectrum, I'm going back a little bit, you want to be aware of your huge risk of secondary infection. So you have a lot of bacteria in your skin, inside your GI tract, and if we are giving antibiotics, we can affect that normal bacteria. And so it'll be secondary infection, superinfection. It's going to be a sign of yeast infections or a sign of C. diff or just diarrhea in the GI tract. Where narrow spectrum should have less risk of secondary infection. Is there still a risk of secondary infection? Yes, it's just less risk of it happening. You're also going to make sure you not give antibiotics for viral infections. You want to be aware of why you're giving it. You want to make sure you tell your patients to take the entire dose of the prescription to, again, help decrease the risk of resistance. You're also going to want to assess allergic reactions, a risk of allergies. No matter what you're giving, you want to assess those. You're also going to want to look out for liver or kidney function. Those are going to be common throughout. Another way you can help study is by listing the complication and listing the drug class that causes that complication. So you kind of do a little flip review. So if you're worried about each drug class and the complications, you look at each complication and drug classes that cause it. That helps in putting together which medications we avoided giving together. So if you know if these medications all cause kidney failure, we should not give them together due to the increased risk of kidney failure. So, actual antibiotics. So, penicillins, they all end in cillin. These have a cross-sensitivity to cephalosporins, carbapenems, meaning that they're all cross-sensitive. If you're allergic to one, you want to caution the use of the other two as well. You're going to want to, every time you give a new antibiotic, you want to give at least 30 minutes, wait to assess allergic reaction before you have them go home. If that happens, just give diphenylhydramine, Benadryl for allergic reaction should get better. With penicillins, there's a risk of kidney failure. With the kidney failure, you're going to want to make sure you are assessing butyrate and creatinine. You also want to be aware you're giving the correct medication that has drug resistance. So penicillins, carbapenems, cephalosporins, they all work through beta-lactam. Beta-lactam is the basically the protein, so to speak, that works on the anti-infective nature. And certain bacteria have a beta-lactamase enzyme. So anytime you see ASC is going to be an enzyme. So basically, beta-lactamase enzyme breaks down the beta-lactam. So therefore, the antibiotic is no longer effective. Now we have augmentin and amoxicillin. These are two types of different penicillin medications that are resistant to the beta-lactamase enzyme. So they're going to be used primarily only in cases where the drug has become resistant, or medication has become, the bacteria has become resistant to regular penicillin. Then we're going to give the amoxicillin and augmentin to help fight it. Cephalosporins, these are all going to end in start in CEPH or CEF. Again, cross-sensitivity from penicillins and carbapenems, meaning you want to avoid them if a cross-sensitivity of those infections or medications. So, what other things you want to be aware of this? So, it's also going to have the risk of kidney failure. So did penicillin. They all work the same way, same pathway. They have some similar complications. Hyperglycemia, set your blood glucose levels. Avoid patients who are diabetes mellitus. Thrombocytopenia. You want to look out for decreased platelets, increased risk of bleeding. You want to avoid NSAIDs, anticoagulants due to the increased risk of bleeding. And then that primarily is going to be your complications for cephs and penicillins. Now again, I'm not going through all the complications. I went through some general ones earlier, so those general complications apply for everything. So secondary infections, your yeast infections, your diarrhea, your thrush, C. diff, all that, we're aware of it already. Carbapenems. Carbapenems end in penem. So the main one's going to be meropenem. Basically, again, cross sensitivity between penicillins, cephalosporins. Want to make sure we avoid that if you're allergic to one. Hypersensitivity potentially to the others. Again, we're also going to see nephrotoxicity, kidney failure. We're seeing in the other two. So BUN, creatinine, fluid status. We now have a risk of seizures. So we want to be aware of avoiding other CNS stimulants. Other CNS stimulants can increase the risk of seizure activity. We also have a risk of ototoxicity, so we want to be aware of bringing the ears and hearing damage. Vancomycin. Vancomycin is a unique antibiotic in that the route in which you give it determines your treatment. So it does not cross out of the GI tract into the bloodstream. It does not cross out of the bloodstream into the GI tract. So if you give it IV, it's excreted renally. If you give it orally or enterally, it's going to be excreted rectally. And so if you're giving it orally or enterally, there's going to be no systemic complications. The only complication would then be the risk of diarrhea because you're giving this localized to the GI tract. It's not going to be a systemic issue. Now, if you give IV vancomycin, this is where we have now systemic problems. The systemic problem is going to be the red man syndrome. Red man syndrome is basically going to be due to systemic flushing or systemic vasodilation. With that systemic vasodilation, the skin, vessels on the skin dilate out, makes the skin look red. That's the flushing. But with that systemic vasodilation, you're also going to have a huge drop in your blood pressure. So you want to look for hypotension. Systolic less than 90, diastolic less than 60. And so to help prevent that, we can give antihistamine, diphenhydramine beforehand. Make sure we infuse it slowly. And then we're going to also look out for ototoxicity. Okay, so we're bringing in the ears. So with vancomycin, one of the main things we're going to do peaks and troughs. So whenever we're giving an IV medication, we also, it's important for us to sometimes check at the peak. The peak we're going to draw an hour and a half to an hour, hour and a half to an hour to hour and a half, whatever, after the infusion is completed, to then see where are the drug levels. Are they normal range? Are they too low? Are they toxic? And then we're going to dose levels based on that in the future. And then we're also going to look at the trough level. The trough level, no matter what the infusion is, or how often you give it, it's always going to be a half hour before the next infusion. We're going to want to see how much, okay, so say it's every 24 hours, this infusion. It's supposed to be given at 8 o'clock. At 7:30, we want to see how much is left in the body. So it's almost ready for our next dose. Again, is it toxic? Is it therapeutic? Or is it too low? We're going to want to make sure we change our doses from there. Tetracycline. These are all going to end in cyclines. And so this we're going to be aware of, first up, esophageal erosion. So do they have a history of peptic ulcer disease or GERD can increase the risk of GI bleed and exacerbate those problems. Anytime you give this orally, we're going to want to make sure we have them sit up for a half hour after they've given it. We want to give an empty stomach in 1 hour before food or 2 hours after food. Why? Well, sometimes when they have GI issues, giving an empty stomach, there's nothing in the stomach, so the medication itself can be dissolved and absorbed quicker, so it's not in the stomach longer, leading to issues. Okay, yes, sometimes you want to give with food to help mitigate issues. This one we want to give an empty stomach, ideally, to help get absorbed quickly. Also, the risk of photosensitivity. So we want to make sure we're wearing a hat, wearing sunscreen, especially if we're using this as a topical agent for acne. It's going to be a huge risk of photosensitivity at that point. But either way, we want to be aware of avoiding direct sunlight. We also want to look for some CNS issues, confusion, can lead to tinnitus, ringing in the ears, again, kind of your ototoxicity. This one now has both liver and kidney failure problems. It also lead to tooth discoloration and affects tooth and then osteomandibular development. So we want to make sure we avoid giving in children under 8 because it can lead to bone growth disorders. We're going to want to make sure we avoid giving with antacids, calcium, foods that are high in calcium, dairy products. And so one of the things we're going to see a lot with anti-infectives is there's going to be want to make sure we want to avoid giving medication with any sort of calcium or iron, magnesium products, which is going to be antacids or just dairy foods predominantly. Macrolides, these end in thromycin. It's important that you remember it's thromycin because remember vancomycin was mycin. This is thromycin, completely different drug classes. Okay, so zithromycin is the main one. These ones are going to be used predominantly because one of the risks we have with anti-infectives is patients not taking the entire course of the treatment. Macrolides have a 5-day course versus your typical 7 to 10-day course. So it's going to increase risk of compliance with, not risk, increase compliance with this, decrease risk of resistance. And so with this, mainly want to look out for, it's going to be the photosensitivity, ototoxicity, and then liver impairment with this. The first one we see, we want to avoid grapefruit juice. This general rule of thumb, grapefruit juice should be avoided with any medication ever. It's going to affect the absorption. For this, when you give it, you give 2 doses the first day, and then 1 dose for the next 4 days after that, 5 days total. Aminoglycosides, now these ones just end in mycin, which is why it's important macrolides we are aware they end in thromycin. Aminoglycosides is just mycin, and with that just mycin, it's going to be a little, make sure you're just identifying things properly. So with this, we're going to have a risk of basically just some lethargy, some CNS suppression, nephrotoxicity, kidney failure, ototoxicity, and also lead to neuromuscular blockade, basically muscle weakness, lethargy, complications like that. Fluoroquinolines, ciprofloxacin is going to be the main one, and then floxin. With this, what we're going to want to do is we're going to want to look primarily for joint and bone pain. Okay, so the arthroplasty, peripheral neuropathy, peripheral numbness, tingling, but the joint pain and bone pain is what we want to look out for because it's a huge black box warning of Achilles tendon rupture. So we want to make sure we are avoiding any strenuous exercise, any strenuous pressure on our joints and tissues. And so we want to make sure we caution that use. Okay. Otherwise, where it's going to be photosensitivity, maybe some abdominal upset. We want to make sure we're avoiding iron, calcium, magnesium products. We want to make sure we give this medication 2 hours before or 4 hours after anything contains calcium or iron. So primarily it's going to be your antacids. So we want to make sure we are avoiding them properly. Bacterium spectra. This one I remember as the trisulf, and so the trisulf, we want to make sure we're looking at it's going to again cause renal impairment. So we want to be aware of liver, B1 creatinine, also going to lead to liver failure. You want to be aware of your ALT and AST. Photosensitivity can lead to complications with your potassium. So you want to make sure your potassium levels are normal range, 3.5 to 5. Look out for the hyperkalemia. You also want to look out for crystalluria. So both crystalluria and hyperkalemia are going to come in from the renal impairment issues. So crystalluria is going to basically it's generally going to be uric acid or calcium trying to get eliminated by the kidneys. It builds up, leading to kidney issues. So to help prevent the crystalluria, we want to make sure we increase the fluid intake, at least 3 liters of fluid a day, to help make sure we are properly flushing out the kidneys and not leading to risks of kidney failure. Let's move over to bone marrow suppression. So remember, bone marrow suppression is going to be suppression of your RBCs, lethargy, tired, with weak, decreased platelets, increase of GI bleed, systemic bleeding all over. So we want to make sure you avoid other mechanisms that lead to bleeding, NSAIDs, glucocorticoids, anticoagulants. And then this is kind of weird because we are giving this for an infection, but it can suppress white blood cells. So we want to be aware of now the infection getting worse. It is a sulfa. And so with sulfas, you want to make sure you are avoiding any sort of alcohol intake because of disulfiram-like reaction. Basically, your body goes into shock and become violently ill, and you throw up the alcohol. Also leads to Stevens-Johnson syndrome. So Stevens-Johnson syndrome is going to be an issue. Basically starts as a rash, and that rash will progress to the point where they become febrile, and the skin basically can start to peel off. So it's a huge risk of infection risk, and then just a high mortality rate. Nitrofurantoin, this one's primarily used for UTIs, can be used for prophylaxis or for treatment. So if a patient is more prone to UTIs, you can take this prophylactically when they are at risk for UTI infection. Otherwise, we want to be aware of, we're looking for, obviously, organ failure. We're looking for liver failure. It can also affect kidneys to a minor extent because you are giving a UTI medication. So we want to make sure you're assessing kidney function, make sure you're assessing the urine, and make sure there is not any telltale signs of a UTI. Other than looking for peripheral neuropathy, the dullness and tingling in the joints, and blood dichrasis. Blood dichrasis basically is a fancy way of saying decreased blood counts similar to that of bone marrow suppression. Blood counts can be really low. When you're treating tuberculosis, you want to be aware of that tuberculosis is hard to treat. It's going to be a long treatment, 6 to 12 months. It's going to require multiple medications at lower doses. Lower doses for a couple reasons. One, decreased risk of resistance. Also, it's going to be a decreased risk of complication for each medication. So you give a little bit of each one, kind of help make things a little easier. They're going to be in airway precautions. And make sure you get the medications at the exact same time every day to maintain the levels. So the main two medications we're going to talk about are isoniazid, INH, and rifampin. These are both going to lead to liver failure issues. We want to make sure we are affecting liver function. When it comes to INH, we want to make sure we're assessing the blood counts or the blood dichrasis again, so it's going to decrease blood counts of all your blood counts. The peripheral neuropathy that happens with INH, we can't want to assess, and we can reverse with pyridoxine. And so if we see that, we're going to want to make sure we give that. Rifampin is going to have a risk of acute kidney injury in regards to increasing your gas levels. With the increased uric acid levels, we're going to have the kidney function. Otherwise, it's going to turn your bodily fluids nice red-orange color, so you want to make sure you're assessing for that. If you get Rifamate is a combination of INH and rifampin. You want to monitor LFTs, monitor liver function. You want to monitor the sputum sample. Sputum sample is going to tell you, is the treatment working? So the sputum sample is still positive and they're on treatment. Treatment's not working. If it's negative, this means treatment is working. Continue. You don't want to assess cholesterol levels because cholesterol and liver function is going to go hand in hand. Increase liver failure. Decreased effectiveness of your cholesterol counts are going to be abnormal. Uric acid levels for both of them, and uric acid levels are going to lead to kidney problems, so make sure we're assessing that. And anytime you increase your gas levels, you want to increase your fluid intake. Flagyl, disulfiram, again, do not want to take with alcohol, cause that shock state. Otherwise, it increased risk of seizures, and then peripheral neuropathy. So make sure you're assessing the neurological status. Make sure you're avoiding patients with epilepsy. You want to make sure you are assessing that numbness tingling in the fingers and joints. Chloroquine, this is primarily going to be used for malaria treatment, either prophylactically or afterwards. You want to make sure you are assessing Vision changes are going to be the big thing here. So photophobia, blurred vision, retinopathy, basically you want to make sure you assess the complications of the vision, do vision testings throughout, and again, avoid NSAIDs, antacids, calcium products, things like that. Antifungals. Most antifungals are going to end in azole. Okay, your azoles, conazole, because azole is going to be something different later on. So conazole are going to be your antifungals. So I want to make sure if you're giving a conazole, you want to make sure you're assessing for kidney function, increased risk of seizure activity, so avoid CNS stimulants, and then peripheral neuropathy. If you're giving nystatin can either be a topical on the skin, where you're going to want to make sure you clean the area, dry the area, and then apply the yellow powder to the entire yeast infection. Or if you want to, if it's going to be for oral conidius or thrush, you want to swish and then swallow. If you are giving it to a small child, you can help them by swabbing it directly to the area of the mouth where the infection, the patches are, because you want them to swallow it down. So why you want them to swallow versus spit is you're going to want to make sure you are coating the nystatin down the esophagus because the yeast infection can grow down. If they have risks of nausea, give them an antiemetic to help prevent that. Amphotericin B is a very, very potent antifungal infection. So this one we're going to do some pre-treatment. There's a risk of something called shake and bake, which is going to be muscle tremors, fever, hypotension, yeah. And so with that, we're going to want to give a 1 liter bolus of saline to help prevent the hypotension, help dilute the blood, so it's going to dilute the amphotericin B. Acetaminophen is going to help with the fever. Diphenhydramine is going to help with some vasodilation issues, help with the hypotension, and dantrolene is going to help with the muscle tremors and help prevent those. Otherwise, we have the risk of bone marrow suppression. All your blood counts are going to be down. We covered that already. Hypokalemia, decreased potassium, less than 3.5. Tachycardia with hypotension. So when we have hypotension, basically what we're seeing is we're having systemic vasodilation, and when the blood pressure drops, our body's going to try and compensate by having reflexive tachycardia. So blood pressure drops, heart rate's going to go up to try and increase your blood pressure. Antivirals. So antivirals, remember, are only going to be for viral infections. They will not be effective for bacterial infections, but antibiotics are not effective for virals and vice versa. So acyclovir is going to be for any sort of herpes infection, chickenpox, shingles, genital herpes, any one of the, or oral herpes, any sort of herpes infection, we can give acyclovir. So with this, we want to make sure we are assessing the blood counts. Red blood cells, hemoglobin, hematocrit, white blood cells, platelets. Check your CBCs. Want to make sure you are checking for your liver and kidney impairment. You want to make sure you are telling people that if they have an active herpes infection, whatever it is, it's strongly contagious and at least be contact. In terms of shingles, there's the severity of the virus itself can actually become airborne as well. So at a baseline, it's going to be contact. It can also be airborne, depending on how many dermatomes the shingles virus has affected the nervous tissue. Oseltamivir is going to be used for the flu. Basically, what this one to be aware of, it's going to help lessen the flu symptoms, but won't really have much effective giving later in the infection. HIV medications, just real overview of those basic HIV medications. Your goal is to want to make sure you give it the exact same time every day, and your goal is to improve the quality of life and decrease the risk of infection, secondary infection, and decrease the viral load of the HIV virus itself. You want to monitor the CD4 T cell counts and just other immune imperfections. You want to make sure they're practicing safe sex or using contraception, and that they are avoiding sick people, large crowds, anything like that to help decrease the risk of infection. So immunity. There's four different types of immunity. It's either natural or artificial, and that's active or passive. So natural or active is basically when what's considered true immunity, when you get an infection, be it bacterial or viral, your body makes antibodies on its own to fight off that pathogen. And then long term, your body will remember, hey, everybody fought this pathogen off before, so I'm going to save these antibodies, and this is how I beat them off. I'm going to keep these for later. Next time I get infected with this again, I can beat the infection easier. Next is going to be natural passive, which means it's going to be naturally derived antibodies, but they're not actively being made. And so it's just passive immunity. This is primarily going to be antibodies from the mother to the baby after it's born. Those antibodies will last for about 3 months, and then by then the baby's immune system should be active enough that you're be able to make its own antibodies, and then also can be shared in the breast milk. But shortly after around 6 months, the antibodies in the breast milk become less potent. So again, at that point, though, the baby's antibodies will be able to make its own antibodies from there. Artificial active. This is basically where we are now going to we're going to artificially expose someone to the pathogen. So vaccination is going to be the avenue for this. We artificially expose the pathogen to the patient, and then from there, they're now making their own active immune system against that pathogen to fight it off in the future. Artificial passive, this is where we give someone just basically generic pre-made antibodies to help with anti immune response in the body. We use it for certain infections, rabies, tetanus, Ebola. But also going to be used for like Kawasaki's in children. But we're going to give IVIG, IV immune globulin, just a generic immune globulin to help with their immune response. Cancer medications. So for cancer medications, basically what you want to remember is every cancer is a little different. How we're going to treat the cancer is going to be different because based on the cells themselves in the division, so on and so forth. So again, we're going to want to make sure we are doing things prophylactically for the patient. If they're going to, the chemotherapeutic agent is going to lead to nausea and vomiting, we're going to make sure that we give an antiemetic before we give the medication. We want to make sure we are assessing for increased risk of infection, because all chemotherapy does is basically it's going to suppress any rapidly dividing cell, which is going to be our blood counts. So we want to make sure there are increased risk of bleeding, lethargy, and infection. So we want to make sure we are neutropenic precautions, where we'll wear isolation, where we will protect them from us. So if we have an infection and note, we can spread it to them. So we make sure we can reverse isolation. We're isolating our own germs from the patient, not the patient's germs from us. And then from that, we also make sure that if they're on strong chemotherapy agents, you have to be specially trained. You'll make sure you put all the bed linen in separate laundry. Make sure you are double flushing any bodily fluids. You want to make sure you're wearing goggles when you're handling bodily fluids. Wearing special anti-permeable gloves with thicker gloves. Waterproof gowns when handling these things. Also make sure we are telling them not to take any sort of live vaccination. Avoid large crowds, avoid sick patients, or just sick people in general, and also avoid eating fresh fruits and vegetables, avoid gardening, basically due to the risk of mold and infections. And that is a review of anti-infectives. If you have any questions, let me know.